Good afternoon, everyone. We're back again here at 12 p.m. to learn with Liz. That would be myself. We're chatting about boosting immunity. This is called Boosting Immunity Plus. So it's a little bit more of a robust protocol that we're going to go over towards the end. And so that's why we call it Boosting Immunity Plus. And I'll try to move through this at a relatively quick speed and just ask that you go ahead and put your questions into the box so that I can take a look at them toward the end. And tell me a little bit more about yourself if you like in your practice so that we can get onto a little bit more of a get to know you basis. And so at the Q&A section, that's where I'll answer questions, and I really do hope to hear from you. Here we go. Okay, so today's discussion, we're going to chat about healthy immunity. 3 of our supplements, QuantaFlora, that's our probiotic and prebiotic supplement. Quanta EPP, that's our grapefruit seed extract supplement, and Quanta Omega-3, that's our omega-3 supplement. We'll do a Q&A just like we chatted about a minute ago, and then we'll talk about aligning with us. So we really do hope that you reach out to us at the end of this presentation or after it, and we can have another discussion about you and about aligning with us. So just a little bit more about me. I am the National Educator and Clinical Consultant with Steiner Labs and PhytoQuant USA. I do have a 15-year nutritional background. Prior to that, I was in the environmental field. And I do have counseling and group workshop experience. Some of the experiences I have are, I started out really in the raw foods movement on the West Coast, and I pretty quickly became a practitioner, able to go through more bio-individual type of nutritional counseling with people, and then ended up working with doctors. I've worked with gastroenterologists, bariatric doctors. I was a bariatric nutritionist for almost 2 years. And then I've also worked pretty extensively with different practitioners and learned in postdoctoral nutrition training, auditing different seminars. I actually audited a 24-month seminar on postdoctoral nutrition training. So I've worked a lot with practitioners and helping you all implement protocols into your practice, and that's why I'm here today. I really enjoy that. And we're going to be chatting about, of course, mainly digestive products, but we all know that products that apply to the gut really do affect a lot of conditions. So we'll get going here, and that is my specialty area. So supporting the immune system is now very timely and critical. Having a strong immune system, including maintaining adequate barriers and building those barriers in the digestive tract, is really a big deal to prevent upregulation of the immune system and to really fortify the immune system. We'll talk about in a minute how, you know, really the body is introduced primarily to non-self through the digestive tract. When something enters through the mouth, it first gets introduced by the tonsils, and that starts to stimulate different types of immunity. And then you have a lot of lymph and ways for immunity to be launched all through the digestive tract. Proper dietary intake and food that is properly broken down is critical to immune support. So again, the literature is really mounting that a gluten-free diet is better than a diet filled with gluten. You're going to avoid a lot of pesticides. You avoid the gluten molecules, which have been hybridized, and it's difficult now for the proline and the glycine to be obtained from the gluten. And so it's worthwhile checking into diets that avoid foods and things that really are stimulating the immune system, etc. So digestion begins in the mouth. That's another thing to really think about. And I really talk a lot with my clients about chewing properly. You know, you have different immune chemicals that are IgG, IgA that are actually secreted right in the mouth. But really also doing the mechanical chewing there produces a more liquid bolus, I guess, and that goes down into the stomach and is more properly digested. Nutrient-dense food is really important as well, getting all the different starchy carbs out, the sugars, the bad fats. I don't like to advocate for just one or a couple types of diets, but Paleo Mediterranean is a good reference point for a lot of individuals, not everybody. Omitting genetically modified foods, that can be a really good place or another good point to bring up. That's going to be really important for fortifying the immune system. And then just in today's world, it's really important to note that a lot of us need some extra support. We need a natural antimicrobial or antipathogenic type of supplement, available to us to combat everything that the world throws at us in this modern age. And so that's also notable. And obtaining critical immune nutrients and absorbing them means really everything. So vitamin C, vitamin D, vitamin A, antioxidants, glutamine, minerals, fatty acids, healthy bacteria strains, etc. So just to remind all of us, 70 to 80% of the immune system really is in the gut. The alimentary canal running from mouth to anus is both the most regular and primary introductory point whereby the body begins to sort between self and non-self. And that's really something to always go back to. This picture illustrates a little bit more about how the body really does sort between self and non-self. Right here at the barrier, you have an M cell. And as you're going through the lumen, then you have macrophages, B cells, T cells that increase in activity depending on what's passing through there. So, you've got all these different lymph patches right there, lying right beside or on the other side of the intestinal wall, where everything's digested. And that's really a big deal. And that's one of the reasons too why they're talking about how, or some practitioners talk about how having an oral vaccine or doing more oral vaccines can be better for people, because it's just much more of a way for more of the immune system to get involved with whatever's being presented to it and really come up with a positive, well-rounded immune response. Stomach acid means a lot. So we all know that if our clients and patients don't have strong stomach acid, it really can be a deterrent from having good health. A lot of the acid blockers are going to prevent people from having the level of stomach acid that they theoretically should have. And then just to talk about, aggregated lymph appears at different GI checkpoints. I kind of already mentioned that, but it's just important to think about that. The lower ileum, the appendix, the cecum, the colon, the digestive tract really is filled with all these opportunities to launch an immune response and to start to sort between self and non-self. Okay, so the gut microbiome is a balancing act. The research is in over the last 10, 15 years that these different levels of bacteria that are considered to be more negative, specifically high bacteroids, are associated with obesity and weight gain. That's a very real thing. So you could do a GI map on your client or patient and find out that they have high bacteroids, and you can say, okay, this is starting point A, and we're going to work on this from here with, a healthy lifestyle approach, supplements, a better diet, etc. High Firmicutes, on the other hand, is associated with more lean body mass. So again, it's just a point of reference, but the research is really in on that. So just to go back over here and look at what's good versus bad. You've got good and bad bacterial flora. Some of the good, obviously, bifidobacteria helps to regulate levels of other bacteria in the gut. It tends to really modulate the immune response, et cetera. And there's a lot of research, again, on these different strains, as you all know. Escherichia coli, apparently it's involved in K2 production, so vitamin K2 production, so that's an interesting point there. And then you've got lactobacilli, so that's another major strain of bacteria. And then you have some of the bad guys, Campylobacter, Enterococcus, and C. difficile. And I just, know that people who are struggling with C. difficile usually have a rough time, but probiotics and prebiotics can be a real help. Saccharomyces boulardii can be a good idea for those folks too, but a lot of times they're struggling long-term with reoccurrences of C. difficile, and maybe they even picked it up from, unfortunately, a hospital. I've seen that happen a lot with folks. So over here on the right, just diagram of pathogenic bacteria acquiring attachment sites. Obviously, you want to get the good guys in there so that when the competition hits, you've got more good guys than bad guys. So this is just a pretty involved slide. The main point here is just a little bit more biochemistry involved and going into the fact that imbalanced flora activates the zonulin pathway, and we see that here in the diagram. So a gluten-free diet is going to have a more positive effect. However, a gluten-full diet or a diet with gluten in it is going to bind to different receptor sites. A component of the grain protein gluten binds to the chemokine receptors expressed in the epithelial cells down in the small intestine and induces MyD88 dependent activation of the zonulin pathway. So the body thinks it needs to flush out the gluten, and the more that there's processed foods or gluten containing foods, the more that this response is going to be upregulated, and these junctions are going to separate. Other things too we've talked about in the past, separating or causing the separation of tight junctions can be things like non-steroidal anti-inflammatory drugs that cause calcium to leave the cells and essentially shrink the cells more, pulling apart those tight junctions. So that's another contributor to the sort of, leaky gut autoimmune type response that can develop. And so, here on the right, you have more of a diabetic type of response, and on the left, you have preserved integrity, no zonulin upregulation, and you have a more normal, better immune type of response. So research is in, as many of you know, and a gluten-free diet and possibly hydrolyzed casein diet. So actually adding hydrolyzed casein into the diet can prevent the activation of the zonulin pathway. So that's notable there. So just talking a little bit about the difference here through PhytoQuant, we haven't had to respond to all these new trends on the market because we've already been, holding as tenants and complying and doing all the different things that are now just coming into trend. For example, transparency, et cetera. And some of the interesting things about us, are here on this page. Transparency, we like to tell people that we're fully traceable from the source of the raw materials to the manufacturing process and to the consumer. And we don't use any pesticides. Many of our plants are coming from the 80 acres that border our manufacturing facility near Parma, Italy. We're complying with ISO 9001 and ISO 14000, which are very high environmental standards, or exceptionally high environmental standards at our facility. We're certified GMP and HAACP. So we're doing quite a lot to bring everybody a high quality product, and we've been doing this for years. The brand, of course, was already started and has been alive and well in Europe for 16 years. We have an 85% or more return buy rate over in Europe and here in the US. So we find we think that that's pretty successful. So we're harvesting in small batches, everything like that. Ultrasound extraction is part of our process, so there's no toxic solvents used to extract the plant material. And that's really above and beyond what most different companies can claim. And it's just kind of an interesting process. You can get to know it better on our website. And we believe in the importance of water. So we know that water carries memory, and our Grander water method, or the Grander method, helps us to zero out or create a clean slate with the water so we can utilize it in the ultrasound extraction processes. And we are not using any chemicals and whatnot, or harsh chemicals, toxic chemicals to clean our machinery either. We're just using plant-based mixtures to do that. So quantum energy is another value or tenet that we hold high, and PhytoQuant uses geobiology at their facility in Italy. And so that's really interesting as well. And you can learn more about that up on our website. So, you know, we really do take pride in some of these things. So 15 exclusive digestive health products that we're offering to you in our line. And we'll be offering more, of course, as well. There are more products that this particular line has to offer, but we all know that health really does begin and disease begins in the gut. So if we can really work on the GI tracts of our patients and clients, we can make a huge difference in their health, including conditions that once seemed very unrelated to GI health, and we now know really do go back to GI health. So our products are made in Italy, they're pesticide-free, they're non-GMO, they're gluten-free, and they are high potency. So immune boosting supplementation, 3 of our products we're highlighting today: QuantaFlora, Quanta EPP, Quanta Omega-3. So QuantaFlora is our probiotic, Quanta EPP is our grapefruit seed extract, Quanta Omega-3 is our omega-3 product. And just to state, these statements have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure, or prevent any disease. Steiner Labs cannot provide medical advice or guidance. You should seek the advice from a medical professional before making any diet or lifestyle changes. Okay, so QuantaFlora, just to start out here, we're talking about a probiotic with prebiotics to maintain intestinal flora balance. And we do find that, you know, the prebiotics, FOS and inulin, really help to implant the probiotics. So, you know, trying to start out with really higher billions and billions of probiotics is not necessarily that relevant if you don't have the prebiotics to really help implant them. So we find that we've got 5 billion units here, but they really do implant very quickly and really do make a difference. So we have a lot of evidence of that from usage over in Europe. We're also adding in the ingredient coriander because that particular ingredient really helps to tame or dampen the effect of the probiotic on the stomach. So it helps to ease any kind of queasiness that might come with taking probiotics for some. So this is our probiotic, and this we do find to be really effective. Again, we have strains here that are more present in the small intestine and some that are more present in the large intestine, and some that are studied for rhamnosus RA or autoimmune type issues. So these particular probiotics do address or speak to conditions like IBS, IBD, so bowel diseases, but different immunity concerns. So really broadly different immune concerns. So we are happy to be able to present that for you in the product. Quanta EPP, this is a rich in bioflavonoid product. It's known to help fight colds, strengthen the body's resistance, and support the system. So this is a pretty, you know, grapefruit seed extract's been around for quite some time, but this particular product we really do like to brag about because we do consider it to be world-class. We do believe it's the best product on the market in the world. There are no pesticides or any kind of solvents used in this product to extract the grapefruit seed extract. And we're using natural vitamin C from the grapefruit plant to accompany the grapefruit seed extract and present you with a really high bioflavonoid antioxidant type of product here. So this particular product has been used in research in Europe, so we're proud of that as well. And it's been shown to be very effective on a lot of different types of bacteria, including H. pylori in the stomach, and other types of bacteria, viruses, fungus or mycosis. and those types of issues that many people are really dealing with. So you have about 1,350 drops in a bottle. And I believe, I could be misquoted here, I believe on the box they have you using about 10 drops 2 or 3 times a day. If you want to be more therapeutic with your clients and patients, we do have protocols that show you can use 20 drops before meals or 30 drops morning and evening, so up to 60 drops. I have seen people do pretty well with keeping bladder infections, for example, at bay with 20 drops twice a day. And you know, if you're dealing with something more intense, like a fungal type of infection or mycosis, you could do 20 to 25 drops 4 times a day. So that would be up to 80 or 100 drops. And those are just protocols. You know, those are just reference points for you as the practitioner. Gum disease is also addressed by this product, so I really like to highlight this product. It's so cool, and we'll go into a couple of other ideas here, but 10 drops and a small amount of water, hold in the mouth for 2 minutes, swishing it around. You can have some real effect on minimizing or addressing gum disease there. So additional benefits of Quanta APP, using it as a topical healer. We have a testimonial where somebody put it on a cut on their finger that was getting infected, then they put a Band-Aid on and it was totally healed up in the morning or the next day. We do have people putting just a drop or a couple drops on toe fungus. That's a common pervasive issue for a lot of people, and I've seen it definitely have an effect immediately on killing the fungus there. So there's a lot of different little uses like that you can think of this product for. We do have dosages for children and babies as well as adults. So all of that is available. And it has a very golden look to it. So unlike other types of grapefruit seed extract on the market, it has a very rich golden look to it when you put a little drop on your finger. And you can use it as a disinfectant for produce. So if you want to just spray your produce and make sure that you're minimizing microbes and things, that's a great idea. And if you wanted to use it as a topical cleaner on your countertop, you could go as far as to do that as well. So I really love this product and I enjoy talking about that. Moving on to Quanta Omega 3. This is another product on the market that we offer, and it's derived from wild salmon caught in the freshwaters of Patagonia. And this supplement helps to produce anti-inflammatory agents called eicosanoids, as many of us know. And so it's helpful as a general anti-inflammatory. So if you're dealing with immune response and you have high inflammation in a client or patient, I like to suggest that people normally go on an omega-3 product. And this one, the salmon, is containing 25% EPA, or excuse me, DHA, and 35% EPA. And basically, you're coming up with about a 3-to-2 ratio of EPA to DHA, which is about what the studies show is optimal or a good ratio to have. This particular product is certified heavy metal free, and it's coming from low pollution and low traffic waterways. So again, you know, if you're dealing with immunity concerns with a client or patient, or you're thinking about mental health, even if bipolar, you know, there's a lot of research done with omega-3s and bipolar, if you're looking at, or different mental conditions, even anxiety, or you're working with possibly an autistic person, and this is a good go-to product. So cellular membrane health, just rebalancing the omega-3, omega-6 ratio in the body. This would be great support in doing so. And then heart and circulation, so any kind of cardiovascular type concerns as well. So, okay, and so just to go generals or overviews on Immune Boost Plus protocol, we're basically providing high anti-inflammatory and antioxidant support. It may kill pathogenic bacteria like H. pylori, fungus, viruses, and other potential invaders that disrupt gut function. It may help in balancing a healthy microbiota to maintain positive gut epithelium health and reduce gut antigen leakage and disruption. and it may reduce overall upregulation of the immune system. So that's what we're trying to present here to you today and consider in your practice with your clients and patients. And oops, I skipped ahead here. This is just a few more things. Again, I think it's 30 drops that's on the actual insert in the box with EPP, so Quanta EPP. So 10 drops in a small glass of water 3 times a day. That's the amount that's suggested on the insert in the product. So again, just wanted to let you all know that. And again, we do have therapeutic usage that shows that more can be successful with different types of, may be successful with different types of infections and things. So QuantaFlora 2 caps per day, you could do that in the morning, before breakfast, 10 minutes before, maybe 15 minutes after. If you think the stomach acid is more dilute, then maybe before bed. So just a couple of other products that, you know, we're getting a little long here, that you can add into your protocols. I like Quanta Alkaline. It's a multi-mineral supplement, calcium, magnesium, potassium, zinc, even vitamin D3 in there. And doing this particular product helps to raise pH, which I guess discourages the proliferation of bad bacteria, bad microbes, etc. Helps with the absorption of different types of minerals and nutrients that people may not be absorbing because of their more acid state, and therefore can help with a lot of potential healing there. QuantaFeel is another great supplement because it basically is an adjunct to our QuantaFlora. It helps to implant the good bacteria better. It also the chlorophyll acts as an antiseptic, and that's coming from stinging nettle. And so it's a really great product, I think, if you want to be kind of gentle as well with what you're offering folks. It does have a little bit of a laxative effect, but other than that, it really works very well to neutralize things down in the GI. So here's some great little reviews. We have someone indicating that Quanta EPP really worked very quickly on their sinus infection. They were going to have to do an antibiotic, and they said this was a lifesaver. So that's a really great testimonial. And someone else saying again that they put it on their little infected finger and they had great results in the morning. And QuantaFlora saying it changed their life. I have had stomach problems for most of my life. I've tried similar products, but they have not worked, and I suspect they did not contain what they said they contain. Since I've been taking QuantaFlora, all of my lifelong stomach problems have gone away. I love this product. So that's a really great review for the many people out there suffering with GI issues. So Quanta Omega 3, again, this person is indicating that it alleviated their brain fog. Like we talked about, it's a great product to use with depression, with anxiety, with other types of issues, maybe like autism. So, and it does not have an aftertaste like other fish oils, no discomfort, highly recommended over EFA supplements. I think it's great for seasonal affective disorder. Therapeutic dosages would be, for this particular product, would be 3 fish oil capsules 3 times a day. So we're going to open it up for question and answers. Let's see if we have anybody who has put anything in here. I don't know that we have anything. And if I'm missing somebody, you can unmute yourself and certainly speak up right now. I'd love to hear from you. Okay, so again, if you want to go ahead and contact me after this particular presentation, I would love to hear from you. And just to say, you know, again, we're here to support you, and we hope that you'd like to align with us. We'd like to set up a Zoom call to find out if we can align with you or if we are aligned. And then you're in a position to receive some samples and try things out for yourself first, at least. So please do think about scheduling a preliminary call with us or take action after this particular webinar here today. So thank you so much for joining me. I really enjoy these. I do love the fact that you've taken some time out of your day to join me as well. And again, you can use our Learn30 code here. This is our complimentary discount code for a one-time purchase. So gather up and purchase as many products as you like for 30% off. And that is good for a one-time purchase here post presentation. We hope you take advantage of that. And then again, please schedule with us. We'd like to chat with you. We'd like to find out if we can align. And we do these product roundtables every Tuesday at 12 p.m. Eastern time. I think we're talking about intestinal and liver detox next week. So join me again next week at 12 p.m. Grab a friend, bring a friend along, another practitioner, and that can have some potential benefits for you if you do that. If you bring someone to our attention and they get involved with us, and they can just click on www.FetoQuantUSA and click on Get Involved up on the website. So thank you so much, everyone, for being here again with me today. As usual, it was great to be here. And I will see you all again next time. And again, I hope I hear from you. This is my email here, liz@steinerlab.com, where you can call me. Thank you so much. Bye, everyone.